everybody. I'm Dr. Anju, I'm an intern in SRM Trichy. Here we are in the first episode of Know Your Calling, which is a very interesting initiative by Dr. Dhairy and his team. And today we have Dr. Suhel, and we're very glad to have you here. Hi, Dr. Suhel.
Hey, hi Anju. How are you?
I'm perfectly fine. I hope you're doing well.
Yeah, I'm doing pretty good.
Okay, thank you. Thank you so much for sparing some time amidst your busy schedule for us.
Not that busy, but yeah, like it's okay. Like you don't have to be so formal. It's fine.
Yeah, that's okay. According to, so the main motive of this meeting is to let the viewers know and clear their doubts regarding radiology and all the different doubts and confusions most of the aspirants have regarding this branch. And I hope that this will be useful to all the viewers. So Dr. Suhel, since you are, can you just give a general introduction about your branch and where are you from, and a small introduction about yourself?
Yeah, I'm Dr. Suhel. I'm basically from Guwahati, Assam. I did my MBBS from Guwahati Medical College, and right now I'm a second-year resident at AIIMS, Patna. So about this branch, all I can say is it is pretty good, and it is very much contemplating. Like in radiology, things are a bit different than your other subjects like medicine and surgery. Here, the more senior you become, the more workload you get. Whereas in other branches like surgery and medicine, as we become more senior, the workload get reduced. So I'm a second year resident, and right now I'm doing more work than what I did in my first year. So generally it is not that tiring. Radiology is all about like sitting in your console and making reports. So yeah, the physical stress is not there, but obviously it is intellectually a bit challenging. In first year, mostly you guys will be posted in X-ray, then you will have fluoroscopy posting, and then ultrasound and CT. Mostly in X-ray posting, there will be some reporting. The patient will come with X-ray where you will have to report. They will come with some chest X-ray, like the mass will be there in anterior mediastinum, posterior mediastinum, whatever. So you will basically learn X-ray. What happens is most of us feel that it is not so necessary and we don't study much, but it is actually very important when it comes to your final exam. And then you will have this fluoroscopy posting where whatever you studied during your MBBS, like the barium swallow, the hysterosalpingography and all those RGU, MCU, you will be doing those procedure. That's kind of interesting also. And then you will get this ultrasound posting where basically you will stand behind your senior. At first you will feel everything clueless because everything is black and white. And for the first 2-3 months, you will feel like whether I'm in the right branch or not, whether this is the right branch, because I felt the same. I felt like, I guess it is not my branch, because initial 2 months I was completely clueless. Like my seniors were telling me this is that. I was like, how can they make diagnosis by just looking at some shades of color, like just the shades of gray and white? But as when you like work more, when you like when you work in the department, you will get to know how to make diagnosis and how to do everything. So in ultrasound posting, basically you will be standing behind your senior, and then you will, whatever he will be saying, you will be writing, you'll be saying, he'll be explaining also. And CT posting, obviously being a first year, you won't be given to make any CT. You will be asked to generally record the history, what you used to do in your MBBS. And at that time I used to feel like, why I'm taking history? This is what I used to do in my MBBS time. I don't think it is necessary. But no, it is not like that. When you will come to report making, at that time I was just taking history, so I didn't know about that. But when you will come to making reports, and when you will have like some 5-6 differential, it is the history which will only help you to come to one conclusion. So it is very important. So basically first year is all about this X-ray posting, fluoroscopy posting, ultrasound sitting, and then you will have to learn physics. Physics is very important. It's better if you complete it in the first year. And in second year and third year, the same posting will only get repeated. You won't have this fluoroscopy and X-ray posting, but you will get additional MRI posting, intervention radiology posting, if that is there in your branch, in your college, like it's there in my college. So right now I am posted in intervention radiology only, and it is actually very interesting. So like that only you will repeat everything. Those mainly there are CT MRI, ultrasound posting. These three are the main pioneers of what I can say.
That's actually you give a whole insight about the branch of radiology because as a UG graduate, we do not know much about radiology. We just have a week of
Yeah,
posting and we just went and stood behind seniors and we didn't know anything much about it. And as you know, like radiology is like the much sorted branch right now. Like everybody wants radiology, and I don't think people
yeah.
actually know what exactly happens in radiology. And
Obviously,
thanks
even
to
I
you
had
that
no
you let us
idea.
know that there's like
Yeah, even I
yeah,
had no
that's
idea when I was
thanks to you
choosing.
because when I got to know a whole lot of information about it.
Yeah, I was very much confused
Yeah.
between
So thank you so much
radiology
for
and
that.
dermat.
Yeah.
Yeah.
Okay. So
No,
what
I'm
made you
saying that
choose
even I
radiology?
didn't
Like
have
you
any
told just now
clue.
that the clarity about the branch.
Okay. To be honest, as
Okay.
of
So
now, I love everything about radiology. Life is pretty cool.
okay.
At least I have a decent social and personal life. I get my own time to connect with my family and friends. Best part is you get
Okay.
free weekends, which is not the case if you are into other stream like medicine surgery, where you will at least have to pay one visit to the ward to see whether the patients are doing well or not. At least we don't have wards because our job is mainly outpatient basis. Only in like intervention radiology, we will admit some patients which are very sick, but apart from that, we don't have any ward. And the main thing what I like is our role in the patient management. Although we are not directly involved, but we are the pioneers. It is intellectually very challenging,
Yeah.
but it is also fun. And the one thing in today's scenario in India, what I feel the one of the added advantages, there is less possibility of being attacked by any patient's relative in case something bad happens.
Exactly.
Because every day we
It's
hear
one of
news,
the
some
most
doctors getting beaten by
worst
attendant.
thing right now. Yeah, like we every day we see a news of a mob attack on a doctor. I think you guys are really safe from that scenario.
Yeah, at least that thing is not there in our branch.
So I understand that you love everything about your field. So are you saying like there is no actual patient interaction? Like you do not have any ward rounds or anything like that sort? It's mostly like
No, it's
intellectual
not like
thing
that.
what you
It's
just
not
mentioned.
like that. Pretty much interaction is there. If you are posted in ultrasound, the patient will come. So they will come with some complaints and all. So you will have to ask them like where exactly is the pain, when did it
Yeah.
started, and some history, some brief history. Then only you will come to some diagnosis because it is otherwise you will be like left with very vast number of like differential, like what to write, what to like. So for that, for coming to one precise diagnosis, you will have to interact with patient. So in ultrasound, the interaction is there. Also, if you are in intervention radiology, so obviously you will have to deal with patient. You will, so it's there.
So I
The
think there's a
interaction is
misconception.
there, but it is much less. Yeah, it is a misconception that the interaction is not there. I have seen, I did pretty lot of interaction with patient, and it is there, but yeah, as compared to other clinical branch, obviously it is very, you can say it is nil as compared to other branch. Hmm.
Okay, I think on a relative basis it's less, but you cannot just completely rule out the fact that there is no interaction at all. I think that's a
Yeah,
misconception, as you say.
because once you pass and go outside the main bread and butter, or you can say the main thing is ultrasound. Like outside you
Yeah.
won't get much of MRI or CT, but the ultrasound, everyone buys ultrasound. Ultrasound is every other like centers will have ultrasound. So there in ultrasound you will have to interact with the patient. So I can say yeah, the interaction is there.
Okay, so let's move on to next question, which the people have asked. What are some of the
Hmm.
cons of being in your specialty? Like, I know that a lot of things you love. Is there anything like you have found, something negative about the field which you have felt, like, or any of your colleagues have felt, which you have observed or something?
Not many I can think of because
Yeah,
it's a good branch, but still everything has a pro and a con. So obviously, so the one thing which I feel is pay is almost fixed. It is not like other clinical branch. The pay is almost fixed. Yeah, the sky is the limit. If you run your own center and all, there is no limit. There is
I
no limit
understand.
you can earn. But if you are working under someone else, so initially the pay will be very high, but it remains static. So that thing is there. Another thing is you'll have to study too much because in radiology it's not like it's an amalgamation of all the subjects. You will have to study opsing and you'll have to study ortho. So studying part is there. Like physical stress is not there, but mental stress is there. You'll have to study a lot. And yeah, if you're into intervention, then radiation exposure is there. Then
Okay.
yeah, I think you need to be good with physics and technology. Like physics is very important.
I'll just, like concise the points that you just told right now. So for the viewers, so basically some of the cons what Dr. Suhel has mentioned is about the static economic growth, then,
Yeah,
like the radiation exposure, then the human, since it's like an amalgamation of all the subjects, you have to have in-depth knowledge of various stuff. Like, and it's like an ever learning process, right? Like you should be aware of
yeah.
many things. So these are some of the things which you should be aware about before taking this branch,
Yeah,
isn't
one
it?
thing is also there, which I don't feel as a con for myself. Like there is no fame or less fame is there amongst the patient. Yeah, the doctors might be knowing you, but not among the general public. Like what the clinician gets, the fame we won't, obviously, because we are at the backside.
You
But
guys are
who
like
cares
behind
about
the
them?
scenes.
Yeah, but
But if it's some
nowadays, like
people
who cares?
actually like that fame and stuff and thing, I
Yeah,
think they should
exactly.
not choose
That's
this
why.
branch.
So those who like that, I think they should not opt for this branch.
Totally go with that. I
But
understand.
nowadays you can get fame from anywhere. Like you have social media, you have Instagram, you can get fame from
Exactly,
anywhere.
exactly, exactly. So that's a good point, actually. Thank you for that. Okay, like let's move on to the next question,
Yeah, okay.
which is like a general question. Okay, so what type of personality should choose this branch? Like and what if personality should not choose? Like for
Yeah,
example, yeah.
there is no set of rules like this person should choose such branch or like this personality should avoid, because when I was when I was in my UG, when I was in my college, when I was in undergraduate, so I used to think that I'll take up pedia. I was like,
Okay.
I was pretty sure that I will take pedia. Then during my
Okay.
internship, I made my mind that no, I'll take up dermat. And when I got a rank, then I was very much confused between radiology and dermat. But luckily, I got radio. I was very much clueless at that time, like whether I will be liking this subject or not. But after coming to this field, I can say like this is one of the best decisions that I have ever made. So it is not like uh, there are some set of rules, but yeah, those who like clinical interaction a lot, for them I don't think it is a right branch. Who likes to interact a lot with the patient, who get adrenaline rush or the zeal after doing some challenging works and all, like patient management. So for them, this is not the right branch. And you need to be
Okay.
good in physics, and you should be like well versed with technology. You should have that insight that yeah, I will learn something like related to technology and all, because ideology is all about this. It's pretty much you can compare it with engineering. Like
Okay, that's actually a very good point because most of the medical students just have to chuck off physics after they clear
hmm,
NEET. Like nobody wants to read physics, nobody wants to know any
yeah,
technical stuff or engineering stuff. So I think they should be aware of this point actually. So thanks to you for
exactly.
mentioning that. Yeah.
And there is
So
one myth,
and
like people think that those who are weak in anatomy or something like that, they should not take up radiology because radiology is all about sectional anatomy. It is not like that. The anatomy which you read in undergraduate and what we are studying now is completely different. It is mainly based on your visual memory. Once you start reporting cases and all, you will get used to it. Even I was very weak in anatomy. Like in INI-CET, there were some, during my time in November 2020 session, there were some 12 to 13 questions. And in anatomy, I attempted all. I just got 4 correct and 7 incorrect. So it is not like that if your anatomy is weak, you should not take up this subject. It is completely wrong. Like you can learn
okay,
that after coming here. Like I am learning right now.
that's okay. So I just got that point also. So I hope people get an idea about that. So let's move on to the next session, which is basically, I mean, everybody has this doubts in mind, but nobody actually talks openly about this. So let's talk about
Yeah.
settlement. So coming to
Yeah.
settlement, because it's one of the major factor which like ultimately everybody has to know about this before choosing a branch. Like it's not only about passion, right? We have to know what is the financial settlement a person can achieve. So coming to settlement, how many on an average, how many years does it take if you pursue radiology to have a settlement in life?
Yeah. I'd be
Stability
honest with
in
that.
career. Yeah, that's what I
I chose radiology. One of the main reason was the monetary aspect only. So I won't lie, because the settlement is pretty good and easy. Once you complete 3 years of residency from any college, after that you can go for SR-ship, which is mandatory. Not mandatory, you can go, or you can if you want to. SR-ship is very important because in 3 years of residency, it is impossible to learn everything. Yeah, you might learn ultrasound and all CT, but it is impossible. Like you will have to do another 2 or 3 years to learn MRI and all, because radiology is so vast, you can't complete everything in just 3 years. Plus in 3 years, you will have to do your thesis. Academics is also there, like you have to study for exam also. So basically it is impossible. So after doing just 1 or 2 years of SR-ship, you can settle. And trust me, India has a shortage of radiologists. People might think that, yeah, the branch is getting saturated. It is not like this. Like if in periphery, if you go now, I have seen the patients coming here, the periphery, all the ultrasound reports and everything, they are being reported by sonologists. Sonologists are the one MBBS doctor who do some fellowship in ultrasound. So there is actually scarcity of good radiologists at the periphery. So settlement is pretty good. Once you pass out, the private, all the setups and all, they will hire you, and the monthly income is, it starts with 3 lakhs per month. Like this is what is going on right now in India everywhere. 3 lakhs per month, because many of my SRs, like, who have passed from this AIIMS, like I asked them like how is the pay scale, they say it's like 3 to 4 lakhs. And like if you are practicing in Delhi, the main Delhi, so you will get like 3 to 4 lakhs at starting. But if you go to some periphery, like those Delhi NCR area, like if you go to Faridabad and all, so you will get much more than that, like 5 to 6 lakhs. And if you want more money, you can work at more centers. You won't have to be limited to just one center, which will pay you like 3 to 4 lakhs. I know some people who works in 3 centers, and they are earning like 10 to 12 lakhs per month. Every center is paying them, and like that they are. And if you are good with management and all, and you have money, you can open your own center. So and if you open your own center, there is no limit. You can even earn 25 lakhs per month. But one thing with opening your own center is like it's a big headache. You will have to get license for running the machine, and obviously you will have to get the machine checked time to time. Management issues, these things are there. So if you don't want to have those problems, you can work under someone, or you can also join college as a professor, which is pretty good.
Okay, I think even if you do not open a setup, like as you mentioned,
that so you will like 3 to 4 lakhs you will get only.
Okay, the minimum is 3 to 4 lakhs, so you can just count on that.
Yeah, 3 lakhs you are getting. Like this is what is going on right now. So by the time you people go, it will increase only.
Yeah,
like,
it might change. Yeah. So you also mentioned about the average years. You told about the big versus small, the periphery centers, difference in that. And what about
exactly. You will get paid more in periphery than center. That's for sure. You get paid more.
And is there any difference in payment in government or private sector, or do you know about that?
No. The payment is almost same. Those who are working in private or government, the payment is almost same. But in like central institute, if you're working in central institute, you won't be allowed to work outside. Like if you're working, because you get non-working allowance like that.
Okay.
It's up to you whether you want to work in a college or you want to go outside and work in private setup. It's up to you.
Okay, so we're done with the monetary part. Let's go to, I think you already mentioned about this, but again, I'm just asking for the sake of, the question is there since it's frequently asked. What free time for other stuff? Like as a resident, do you get free time to pursue your hobbies or, like outings and hang out with friends? Do you get time for that?
Yeah, you will have it more than your colleagues from other branch, no doubt in that. Because residency is all about working. So in residency, you might not get that much time, but after passing, obviously you will have fixed hours, like you will have 9 to 5 like that. So your hours will be fixed and it will be very flexible and fixed. In residency also, you will get more free time because your weekends are generally off. Unless and until you work in emergency, like emergency radiologist, who is working in emergency, like who is having emergency posting. Apart from this, like you don't have to go to in the weekends. Like all my weekends are off only. I stay at my room, I chill. So you will have good free time.
I mean, that's actually really nice to hear, because most of the people whom I know, I mean, the postings, I just see them working 36 hours, 48 hours duty and all that.
Yeah,
So this is
in
really
our branch it is
tempting
not
to
like
hear,
this.
actually.
The most is like,
So, like,
I can say some 16 to 18 hours, like during like city posting, which is very tiring and very hard. Like,
so that phase is over. Next is future of growth in the branch. Like, is it necessary that you should do a super specialty, or is it just an end branch that you're not pursue anything further, or you should do some fellowship for further? Is there any scope for growth?
yeah, obviously it is there. But radiology is mostly an end branch. This is one of the main reason why I chose radiology, because it is mostly an end branch, but there are DM courses like neuroradiology, intervention radiology. So plenty of fellowship also like PDCC. So through INI-CET, you can take admission at AIIMS Delhi, NIMHANS, and this PGI Chandigarh. They have neuroradiology course, intervention radiology course. And through NEET super speciality, you can take it. SRMC Chennai is there, then TMC Mumbai, where you have this intervention radiology DNB courses there, MD courses there. So, but one thing is there, if you have the typical radiologist point of view, so you should not come, because if you want a 9 to 5 job, this is not the right branch for you, because intervention radiology is a bit hectic. You will have to have a mentality like a surgeon, because stroke can happen anytime, and you could be called anytime to do some intravenous therapy like the IV thrombolysis and all. So, but what I
I
feel is people are mostly limited to diagnostic only, because the subject like neuro intervention, it is getting very constricted, because neurosurgeon and neurologist are also doing the same thing. And the patients primarily, they will present to them only. They won't present to radiologists, right? They will present to them. So they are also doing the same thing. However, other body intervention like all those pigtail catheter insertion, PTVD and all has got a lot of scopes. So you have DM courses, but if you don't want to do DM, like very limited seats are there, you can do PDCC, which is generally 1 year course of fellowship. You can do PDCC in various various what this system like the musculoskeletal system, fetal imaging. You can do PDCC in cardiac radiology, thoracic radiology, this gastroradiology. All like many of the institute are providing fellowship courses like this. Institute of Liver and Biliary Science in Delhi, they have this PDCC course of gastroradiology, SGPGI. Even our AIIMS has started 1 year PDCC course for intervention radiology. So what I feel, I
Okay,
might
but
do some
this is
PDCC course
totally
after passing,
optional.
because I'm pretty sure I won't do any DM. It is optional. Yeah, it is up to you, because if you get a PDCC degree, so you will be more limited to that side. So your income might get constricted, but it is not like that. You will have a broad idea, but yeah, you will be getting a bit constricted. But yeah, it feels good when you add more degrees to your name. So it's up to you whether
Yeah,
you
that's.
want to do or not.
I mean, this is totally new information. Like people, I didn't know that there are a lot more scope after radiology also. But
Yeah.
you threw light upon those topics. So that's nice.
Hmm.
Thanks for that.
Yeah.
What are some of the basic things a person must consider? I think you covered this question. Like, is there anything you have to add on? Like some things which things to be considered for choosing a college for the branch. Like, does it matter that you have to do from Central Institute or any government institute?
No. It doesn't matter. Like for surgical branch, they say na, if you do it from state college, it is better than doing it from a central college. But it is not the same for radiology. One thing which I want to focus is all those machinery should be advanced. All the modality should be present at that institute. Good patient load is not a necessary criteria, but it is one of the criteria in case of ultrasound. Otherwise, the CT and MRI, we have PAC system where we store all the data. So the previous 5 years, 6 years, all data are stored in the system. So you can retrieve those data and study. Like if suppose like what we have seen into 2020, there was this COVID hole. So obviously it affected studies and all. Patient load was not there. But before, obviously, if that particular institute will have this PAC system, so the resident can easily study from those already saved data. They can browse to all the CT, MRI and go through it. So it is not so important, but yeah, having most advanced modality and all the modality is one of the important. Like that, if that college doesn't have MRI, then it is one of the drawback. Like many of the colleges in India, they don't have MRI.
Okay, so they
like
have
that.
to
So you
consider
should
about the
see
technical availability in the college.
technical availability. The machine should be advanced like that. It is one of the main important thing. Like in other clinical branch, they say that the patient load should be good. You should have a hands-on during the surgery. Not the same with radiology. Yeah, patient load is important when it comes to ultrasound, because you will have to practice on them only. You can't practice on someone who is fine. You can't just practice on your friend. You need some obviously patient who is coming, but other like CT and MRI, obviously you can learn from previously saved scans also.
Okay, so one of the, I do not know whether it's a misconception, but this is generally heard among people that in the future, you know, artificial intelligence can take over radiology and the radiologists will be out of work. I know this is like, I don't believe it personally, but what is your say in that? Like, I've seen many people asking these questions on Quora and other websites like that. So can you just tell me what do you feel about it?
Even I had the same doubt before joining radiology, and I was searching a lot in Quora and internet. So
Okay.
I don't have much idea about it, but yeah, all I can say is artificial intelligence is everywhere. It is not just the engineering field, it is also in the medical field. It's not just in the like in Google, you have it everywhere. And to be honest, the fields are getting benefited from it. We all know that medicine is not so simple and linear. Obviously, artificial intelligence can't replace us. There are so many factors we need to consider for making a diagnosis than just reading the MRI and CT scan. So our work is not just limited to making diagnosis, but it also involves like critical thinking and all, like problem solving skill should be there for making the diagnosis. All I can say is, yeah, the artificial intelligence can never replace radiologists, but yeah, since it is coming more into the field, and in future I think it will be more evident. So I can say that the radiologists, uh, artificial intelligence is actually making work bit easier. So the radiologists who will use artificial intelligence in future will surely replace the radiologists who won't. But it is not like that artificial intelligence will replace the radiologists. It is the radiologists using them will replace those who are not using them.
Okay, that's really nice, you know, because it's rather a boon than a curse, right? Like what people tell.
Yeah,
People make it seem like it's you know, it's a bad thing that artificial intelligence will overtake this, but you have given a valuable point that which actually makes sense.
yeah, you don't need to worry about that. Like people get uh, uh like this is a misconception only. They get afraid like what if artificial intelligence take over. No, it is not going to happen. it, this thing is there to benefit us only, so obviously
Yeah,
it
because
won't
the same
replace.
thing we can tell about even the robotic surgeries that's taking place. Even
Huh,
though the robotic surgeries, still the surgeon is
but the
needed there.
surgeons
Like
are only doing
yeah,
surgeons are
yeah.
only doing only, they are
They're
only
just
operating the
making the
robot.
work of the surgeons easier. So as we tell, the
Easier.
artificial intelligence is gonna
Huh,
make your work easier. They're just gonna
work
never
only
gonna
easier.
replace you guys.
Replace it
Yeah. So
can't replace obviously.
I think like the worry of most of the people is cleared right now because I think again nobody
uh,
needs to go and search on internet and Quora whether they have to
yeah,
worry
exactly.
about robots overtaking them.
No, you don't have to worry about that. Yeah.
Okay, so is there anything in particular or any special message that you want to tell the viewers? You know, like is any for the aspirants, those who are taking radiology, or anything that you want to add on top of all this, like something from your side?
I just want to say that if you are taking radiology, your life will be very much easy. That's what I'm feeling right now. Because till my internship, I had no clue about radiology, because radiology used to be an optional posting, and we never did that posting. So I had no idea what radiology is. So obviously, before so choosing this branch, I had several like too many ifs and buts back in my head at that time. And I asked few of my seniors like how is radiology and all. They said ki radiology is pretty good. If you can study a lot, then this is your branch. If you don't like much of a patient interaction, then this is your branch. Then it is not that you don't get any sort of patient interaction. It is there in your ultrasound posting and all. You will be interacting a lot with patient. At times you will get frustrated with it because the patient will be shouting mera number kab aayega, mera number kab aayega. This is what happens there only. Like too many load, the load is very much here. Like every day we are doing some 250 ultrasounds in just like 8 hours of day. posting, so the load is much. At some time you will feel frustrated, and this is pretty good branch. Life will be easy. You will have a social and a personal life apart from, because your life is not only about this medical field. Obviously, it is just a part and parcel of your life. So obviously you will have to enjoy everything. So radiology mein to you will get to enjoy everything. That's what I can say as of now. From my 18 months of residency, that's all I can say. So
as far as like from
hello, I can't hear you.
the free time you guys get, and like the work satisfaction. You can hear me now?
Yeah, I can hear you. Say again.
No,
Actually, it got paused.
What I was telling is from as a youth student, so science like the white collar field of medicine, So that's what is a general public stock. So I think like from what you told, like 95% of that is true because of the extra free time you guys get compared to other departments, and the work satisfaction, then the pay and the
It is there.
settlement and all that, and not the mandatory
At least you can
post-fellowshipping
sleep
which we do,
peacefully
because
at night.
medicine,
And you can also sleep
that's a
peacefully
good
at
thing.
night.
Yeah, I think like you have perfect. Yeah, and you actually threw a lot of light on many many things that generally we do not know. That you told us about the interventional radiology and all other things like periphery, the central difference, and all that. So we got. I'm really thankful to you for like telling us about all that, and honestly telling us everything. Like not like just polishing and telling just the
Yeah,
good things.
because
You told
this.
both and positive. So thanks to you
Yeah.
for that. So I just hope that people who are watching this will actually, like think once or twice before choosing radiology. Like hope
Yeah.
everybody benefited from this. So thank you, Dr. Suhel, for being a part of this. So we can sign
Thank
off
you so
now.
much for
Right?
taking up my interview. And I would like to say one thing, like I fumble up a lot during the interview. So if you have any more doubt, you can just contact me on my Instagram. So I'll be happy to help you there, because I'm a bit of a camera shy person. So it would be great if you contact me there if you have any doubt regarding radiology.
Okay, we'll share your Instagram handle also to the viewers so that if they want to contact you, they'll contact you personally. So thank you.
Okay. Okay.
Okay,
Thank
bye.
you. Hello. Bye. Best of luck. Best of luck.
Thanks. Thank you. Thank you.